Hello, this is Dr. Corey Birchman. I'm a member of the Prime Alternative Treatment Centers of New Hampshire medical staff, and I'm here today to discuss with you cannabinoids, the molecules responsible in medical cannabis for therapeutic effects. I'll call this lecture Cannabinoids 101. What is exactly the medicinal basis for cannabis? The picture is incomplete, but we do know that cannabis helps cancer patients endure the wrenching nausea of chemotherapy. It can make a huge difference in multiple sclerosis sufferers, allowing some to enjoy an afternoon free of their constant pain and spasticity. Cannabis can deliver significant seizure reduction to children with epilepsy, so their seizures can be controlled more than conventional medicines and with fewer side effects. What parts of cannabis actually provide these health benefits to patients? And what separates medical quality cannabis from that which should be avoided by the consumer? Let's examine more closely the primary chemical components in cannabis. The primary chemical components of cannabis, which translate into effects felt and valued by patients, are classified by the medical term cannabinoids. When cannabis is consumed, cannabinoids bind to receptor sites throughout the brain. These receptors are called CB1 and CB2. CB1 is primarily in the brain, CB2 primarily in the body. Different cannabinoids have different effects depending on which receptors they bind to. For example, THC, tetrahydrocannabinol, binds to receptors in the brain, whereas CBN, cannabinol, has a strong affinity for CB2 receptors located throughout the body. By targeting the right cannabinoid to the right receptor, different types of relief are achievable. This is in fact how all pharmaceutical agents operate. There's a drug and a receptor. Cannabinoids enter the body via the lungs as smoke and as vapor when the cannabis flower is combusted or vaporized. Alternatively, it can be absorbed through the stomach when consumed as an edible product. And further, it can be delivered through the skin, as is the case with cannabis topicals. The path via smoking and vaporizing is slightly different than that of cannabis when eaten. The effects of ingested cannabis are typically stronger and have a longer duration because it is processed by the stomach and liver before it enters the bloodstream. This process actually produces slightly different molecules. When metabolized by the liver, THC changes from delta-9 THC to 11-hydroxy-THC. This concept is the cornerstone of cannabis as medicine, and the results are so promising that these cannabinoids have been synthesized for legal prescription use. Some synthetic cannabinoid medications include Marinol, Nabilone, and Rimonabant. And while these synthetic forms are effective, research has shown that herbal cannabis contains a far wider variety of therapeutic compounds. The concept of the entourage effect was introduced in 1998 by Israeli scientists Shimon ben Shabbat and Raphael Mechoulam. The theory is that cannabinoids within the cannabis plant work together through a network of relationships and affect the body in a mechanism similar to the body's own endocannabinoid system. Basically, these compounds work better together than in isolation. The long-standing successful use of cannabis as a whole plant to be used medicinally suggests its medicinal superiority in comparison to products containing isolated single components of the cannabis plant, or synthetic cannabinoids trying to replicate the natural components. Research on the benefits of THC and CBD, that is cannabidiol, in isolation is well established. THC demonstrates analgesic, anti-nausea, and anti-inflammatory properties. CBD possesses antipsychotic, anti-seizure, and anti-anxiety properties. However, evidence is mounting that by isolating these cannabinoids or creating them in a laboratory, that result may have very limited therapeutic effect. It is also the reason visits to a doctor or an emergency room have increased. When delivered in high concentrations, THC can cause overdosing. Although an acute THC overdose rarely requires medical intervention, the side effects can be very unpleasant. There is solid scientific evidence now that shows that THC and CBD work in tandem. The synthetic cannabinoid Marinol is another example. Marinol is a pure synthetic form of delta-9 tetrahydrocannabinol, or THC. When the drug was first introduced in the mid-1980s, it was thought that it would have the same effect as the cannabis plant as a whole. However, it soon became clear that most patients were not responding the same as when THC is consumed by smoking or ingesting naturally grown cannabis. Research soon realized that other compounds, such as CBD and various terpenes, play a larger role than previously realized. Cannabinoids were first discovered in 1940 by Roger Adams in the United States, and again in 1964 by Raphael Mechoulam at the Hebrew University in Jerusalem, Israel. These special chemicals work synergistically with the human body, and more specifically, they comprise the endocannabinoid system. It has been determined that there are over 100 cannabinoid compounds found within the cannabis plant. This includes the most widely known examples like THC and CBD, as well as lesser recognized substances found in significantly smaller quantities like CBN, CBG. There are also variants of major cannabinoids like THCV and CBDV. When smoked or vaped, cannabinoids enter the bloodstream via the lungs. Once in the bloodstream, the heart circulates the blood, a major proportion of which perfuses the brain. Once in the brain, cannabinoids seek out specialized receptors into which they fit almost perfectly. Technically, this lock and key mechanism is termed binding affinity between the cannabinoid molecule and the receptor site. This entire process requires little more than 2 minutes. Thus, from the time a patient takes a hit of smoke or vapor, roughly 2 to 3 minutes will pass, depending on one's metabolism and body chemistry, before the patient begins to feel psychoactive effects or medical benefits of the cannabinoids. Those benefits include reduced pain, inflammation, or reduced nausea, which are 3 of the more common medical purposes of cannabis. THC, or tetrahydrocannabinol, also known as delta-9 THC, is the most common cannabinoid and the primary psychoactive constituent of the plant. THC is what delivers the euphoria, relaxation, and alteration of the senses, commonly referred to as a high. However, THC also provides significant medical therapy to patients in the form of anti-inflammatory effects. For example, cannabis has shown to have a significant effect upon Crohn's disease in inflammation of the gastrointestinal system. THC has also been shown to have efficacy in treatment of psychological conditions like depression and PTSD. Some strains of cannabis may contain as much as 25 or even 30% THC. The intensity of such strains can cause confusion, disorientation, and paranoia in some patients. Yet, for patients with high tolerances for cannabis or patients with chronic pain, high-potency concentrates exist, and extracts from the cannabis plant can typically contain 40 to 90% THC. THC molecules begin in the dried and cured raw flower of the plant as a slightly different molecule called THCA. The A stands for acid because THCA is simply the acidic precursor to THC. While this might sound complicated, it means simply that the THCA molecule must lose a carbon dioxide molecule that splits off after the application of heat during smoking or vaporization. This CO2 molecule is simply lost, while the new THC molecule suddenly possesses a very high binding affinity with special receptors as mentioned above. Other cannabinoids, such as CBD, also feature acidic precursors, as in this case, CBDA. I realize that this sounds a lot like alphabet soup, but it's important to just understand that cannabinoids are molecules, and there are precursors to those molecules which are then activated once heat is applied. Now let's talk a little bit about the cannabinoid receptor. There are primarily two types of cannabinoid receptors in the body's endocannabinoid system, CB1 and CB2. As mentioned before, CB1 receptors are found primarily throughout the brain and central nervous system, and they accommodate the THC molecule. Because they are found in their largest concentration in the brain, it is believed that this cannabinoid is responsible for the psychoactive effects of cannabis. CB2 receptors found throughout the immune system and in its associated organs bind with CBD, or cannabidiol, which is a cannabinoid that delivers no cognitive alteration or cerebral activity. CBD has, however, been shown promise as a therapeutic medical agent, quite effective at reducing seizures and possibly shrinking tumors in both children and adults with severe conditions like epilepsy and cancer. There are most likely additional receptor types that have yet to be elaborated. The DEA's Schedule I status of cannabis has resulted in a lack of cannabis research in the United States, and it has inhibited the scientific progress necessary to learn more about cannabinoids, the endocannabinoid system, and the delicate interaction of the two, something called the entourage effect. With a much anticipated revision of the Controlled Substances Act, when the classification of cannabis reverts to a Schedule II or Schedule III agent, cannabis research in the United States will expand. At this point, human trials will occur, and it will yield the data necessary to best help patients gain safe access to targeted medical approaches. In the meantime, there is significant research that is being done abroad, where the scheduling constraints of cannabis do not exist. Now, a word about cannabis therapeutics. Each disease and the patient's response to disease varies. Further, the composition of cannabinoids, the cannabinoid profile within a class of strain of cannabis, can vary tremendously. There is, however, a vast body of knowledge that has been accumulated over 5 decades since the THC molecule was first described. The cannabis and medical communities know enough about the effects of cannabinoids to administer CBD oil to children with epilepsy and THC to Crohn's patients. Unfortunately, the most important thing known to the cannabis community is that more research is necessary into the sometimes subtle manner in which cannabinoids interact with the human body, including how they buffer and temper each other and how they interact with other special molecules found in cannabis, including terpenes. What exactly are terpenes? Cannabis has a strong smell, and each strain has a unique scent profile. Each of the thousands of cannabis strains have individual effects. Surprisingly, it's not just because of the cannabinoids, but something else just as important: terpenes. Terpenes are the next frontier in medical cannabis. Terpenes are the essential oil that provide different strains of cannabis with their unique flavors and scents. Terpenes are not only in cannabis, they are found in almost every aromatic plant. When one breaks open a popular strain of cannabis, a piney smell which emanates is due to alpha-pinene, a terpene which is also found in pine needles, rosemary, basil, parsley, and dill. When handling other popular strains, a citrus smell that is released from the buds is limonene, another terpene, found in oranges, limes, lemons, rosemary, juniper, and peppermint. These essential oils are important to the distinct profile of each strain. Medical cannabis testing labs are now accounting for terpene content in the tests on cannabis products. And while they're critical to the flavor and smell of all cannabis, they are not just flavorings. They are believed to play a role in the delicate interplay between cannabinoids in cannabis and the human endocannabinoid system. The diverse palette of cannabis flavors is impressive enough, but arguably the most fascinating characteristic of terpenes is their ability to interact synergistically with other compounds in the plant, like the cannabinoids. Terpenes act synergistically by binding to the same receptor in the brain, our friend the CB1 receptor, as THC does. Terpenes are believed to regulate the chemical output of these same receptors after the THC and terpenes are bound to the receptor sites. As you can understand, this is a very complex interaction. Not unlike other strong-smelling plants and flowers, the development of terpenes in cannabis began probably for adaptive purposes, possibly to repel predators and lure pollinators. There are many factors that influence a plant's development of terpenes, including the climate, weather, age, and maturation, as well as fertilizer, soil type, and even the time of day. Over 100 different terpenes have been identified in the cannabis plant, and every strain tends a unique terpene type and composition. Over the past several decades, hundreds of cannabis varieties have been bred to contain high levels of THC, but only recently have the other cannabinoids like CBD, CBC, CBN have begun to receive scrutiny. Cannabinoid researchers are now understanding that terpenes may help account for the unique effects induced by each cannabis strain. The effects these mechanisms produce vary from terpene to terpene. Some are especially successful in relieving stress, while others promote focus and acuity. Myrcene, for example, induces sleep, while limonene has been noted to elevate mood. There are also effects that are imperceptible, like the potential gastroprotective properties of cryophyllene. This concludes the discussion of Cannabinoids 101. Please refer to the website of PrimeATC for further details and ways to contact us, as well as pose questions. Our job is to make you comfortable and informed about your use of medical cannabis. This concludes this discussion. Thank you.